The World Health Organization estimates that about 3.2 billion people, or nearly half the world's population, are still at risk of malaria in 2016. Over 2/3 of those vulnerable people live in the Asia-Pacific region. Since 2000, the number of malaria cases occurring in Asia-Pacific countries has dropped by over 45%, according to new estimates from the WHO. This new data reveals impressive regional progress as countries move towards malaria elimination. But a new challenge has arisen. Multi-drug resistance to malaria has emerged in Southeast Asia and now threatens the progress made earlier in controlling malaria. Deaths from malaria in Asia-Pacific could double as a result of resurgence.
So we've seen extraordinary progress in the fight against malaria over recent years, but we have also seen historically drugs become onto the market and then reduce their efficacy quite rapidly. We saw it with chloroquine, and we're now seeing it with a range of drugs that are used to treat malaria. This is emerging in the Greater Mekong sub-region, and we're seeing very high, what we call treatment failure rates.
What we do have in Asia Pacific is a threat of drug resistance. And the biggest challenge with that is, if it spreads, if it goes west, which it started to do already, it could have catastrophic consequences to the population and the work that's already been done over the years in Africa.
At the East Asia Summit in 2014, leaders from 18 countries in Asia-Pacific agreed on the goal to make Asia-Pacific free of malaria by 2030. This bold commitment will strengthen regional prosperity by saving more than 1 million lives and generating over $300 billion in economic benefits. The leaders called for a plan to achieve this goal, and the Asia-Pacific Leaders Malaria Alliance, APLMA, engaged extensively with stakeholders across the region to develop the plan. The roadmap was endorsed by Asia-Pacific country leaders in November 2015 at the East Asia Summit in Kuala Lumpur, Malaysia. The roadmap consists of 6 essential priorities that would accelerate progress towards malaria elimination, both on the country and the regional levels. The first 3 priorities outline key ways to establish a robust and coherent approach. The other 3 present key ways to build sustained and effective financing and delivery. Malaria elimination will take unparalleled collaboration, and together the 6 priorities will establish a coordinated approach to malaria elimination in Asia-Pacific. As nations implement these priorities, country leaders and APLMA will play an important role in ensuring the region achieves the 2030 goal.
The main roles of APLMA is to bring the commitment of the leaders into practice so that each and every country, as members of the alliance, will be able to achieve what was committed by their leaders, which is elimination of malaria at the latest in 2030. And for that, it is very important that the APLMA shows the leadership, provide the guidance, and provide the roadmap how to get there.
Asia-Pacific is heading towards meeting the goal of having the region free of malaria by 2030. The region's governments, experts, and communities are working together in new and unprecedented ways to successfully eliminate malaria, to save more than 1 million lives and generate over $300 billion in economic benefits.